Great news last week out of Kentucky. The Bluegrass State is the first in the union to apply work requirements to Medicaid. The left and the media, though I repeat myself, are losing their minds over this reform, the most significant change to the program in its 50 years of life. Those who want to receive Medicaid benefits in Kentucky will now have to show that they have worked just 80 hours in a month. That's barely part-time work, just 20 hours a week. And it doesn't even have to be real work. Taking classes or job training or even community service applies to that 80 hours a month. Those who think this health insurance welfare program for the poor shouldn't come with strings attached need to realize something. Everyone else in America who does not have taxpayers picking up the tab for their health insurance works for it. In other words, their health insurance is part of their employment. If the people paying the tab for Medicaid, the taxpayers, have to work for their health insurance, why can't the recipients of Medicaid do so as well? That is not an unreasonable request, and it comes with other benefits as well. Kentucky projects it will reduce its Medicaid rolls by 86,000 people within 5 years, largely because those former recipients will have obtained full employment and better health insurance. The state will also save more than $300 million. The sensible reform requiring work to obtain Medicaid will soon spread to other states, especially if Heartland has anything to say about it. We've been pushing for this reform for years. We've held workshops on the topic with state legislators. We've written dozens of research papers and commentaries about the issue. We met with the Centers for Medicare and Medicaid. The Trump White House has even asked Heartland several times to submit background information to them on this needed reform. Work requirements for Medicaid are good for the states. They're good for the taxpayers, and most importantly, they're good for recipients of the benefit, who will no longer be getting a handout, but something they earned, even if they are forced by law.